Managing high blood pressure is, well, it's a really persistent concern for so many of us. And usually, the first thought goes straight to medication.
That's the standard approach, absolutely.
But what if there's another way? Could we genuinely normalize blood pressure without drugs? And, what advantages might that bring?
It's a big question.
It is. So today we're doing a deep dive into a different perspective on managing blood pressure. Our mission is to pull out some surprising facts, some actionable stuff from a really interesting source.
Okay, what have we got?
It's a YouTube video transcript from Dr. William Davis called How to Manage High Blood Pressure Without Drugs.
Ah, Dr. Davis. Okay, this should be interesting. He often challenges conventional wisdom.
Exactly. And one of the first things he brings up, something apparently doctors themselves grapple with, is this idea of residual risk.
Residual risk. That sounds ominous.
Doesn't it? It implies that even if your blood pressure numbers look good because of medication, the risk isn't actually, gone.
Huh.
What's the source say about that?
It's quite a striking point. The source explains that even if someone's blood pressure is, say, perfectly controlled at 120/80, but they're on multiple drugs to get there, maybe a diuretic, a beta blocker, an ACE inhibitor.
Right, a common cocktail.
Exactly. Even then, they still face substantial cardiovascular risk. It's been called a puzzling question in medicine because, shouldn't the meds fix the risk?
You'd think so.
But it suggests the medication isn't getting to the root cause, it's just managing a symptom. The source goes so far as to call the medical treatment of high blood pressure a deeply flawed area.
Wow, deeply flawed. That definitely makes you pause. It's not just about hitting a number then.
Not at all. And beyond that residual risk, these medications themselves, they come with side effects, sometimes pretty significant ones that maybe don't get enough airtime.
Like what? What does the source highlight?
Well, take mild diuretics, for instance. Things like hydrochlorothiazide, chlorthalidone. They work, yes, but they also cause you to lose quite a lot of essential minerals in your urine.
Oh, like what minerals?
Potassium and magnesium, mainly. And this isn't trivial. It can lead to hypokalemia, that's low potassium, and hypomagnesemia, low magnesium.
And what are the consequences of being low in those?
They can be really serious. We're talking bone thinning, heart rhythm problems, even sudden cardiac death in some cases.
Gosh.
Yeah, the source mentions anecdotally from decades in cath labs and critical care units that seeing critically low potassium or magnesium during a cardiac arrest resuscitation is an everyday phenomenon. Giving FAV magnesium or potassium is often life-saving.
It's sobering, really sobering.
Okay.
What about other common drugs like beta blockers? Metoprolol, atenolol, those names.
Right. Beta blockers have their own issue. They can actually amplify insulin resistance.
Amplify it. But isn't insulin resistance already a big problem, often linked to high blood pressure itself?
Precisely. So you might be taking a drug to lower blood pressure, but it could be making you more likely to become pre-diabetic or even develop type 2 diabetes down the line. It underlines the point that these drugs are, as the source says, not flawless. They can solve one problem while potentially creating another.
Okay, so the picture emerging is
Yeah.
meds lower the numbers, but maybe not all the underlying risk, and they bring their own baggage. Which leads us back to the core question.
Can you do it naturally?
Yeah. Can natural methods really work? And do they avoid these issues, the side effects, the residual risk?
According to this source, the answer is a clear yes. When you normalize blood pressure naturally, you're not taking drugs, so obviously no drug side effects.
Makes sense.
And because you're addressing the root causes, that whole issue of residual risk just isn't there. The source points to real-world examples.
Like who?
Studies on indigenous hunter-gatherer populations. Think of groups like the Maasai. People who live off the land hunt, gather, fish. They consistently show normal blood pressure, often right into old age, no meds needed.
Okay, that's fascinating. But here's the kicker, right? What happens when they change their lifestyle?
Exactly. This is presented as a really important lesson. When people from these populations move to cities, adopt modern diets, modern lifestyles, many become hypertensive, sometimes severely. The source mentions examples like blood pressure hitting 210/110.
Whoa, that's a dramatic shift. It really points the finger at environment and lifestyle, doesn't it?
It strongly suggests our modern way of living is driving these problems. The source identifies 2 key processes we need to fix to get back to a healthier state.
Okay, what are they?
First, normalizing insulin resistance. It's incredibly common now. It makes the pancreas pump out too much insulin, leading to belly fat and raising the risk for heart disease, dementia, even some cancers.
Okay, insulin resistance, what's the second one?
Reducing inflammation. And these two are linked in a nasty cycle. Inflammation helps expand abdominal fat. That fat then causes more insulin resistance, which causes more inflammation. Round and round it goes.
A vicious circle. Okay, so breaking that cycle is crucial. Where do we start? What's the first practical strategy the source suggests?
Pillar number 1 is what the source calls dietary restoration. Basically, getting back to an ancestral eating pattern.
Ancestral eating, what does that actually involve?
It means eating whole animals, not just muscle meat, but organs, liver, brain, stomach, kidneys. Making soups or stews from bones and tendons. Adding root vegetables.
Okay, and what's not included? This is probably key.
Absolutely key. This way of eating is devoid of all wheat and grains, all of them. And it has minimal sugars.
No grains at all. That really goes against a lot of standard dietary advice, even the healthy whole grains message.
It does, and the source critiques that directly. It says studies comparing whole grains to white flour kind of miss the point.
How so?
They might show a small benefit for whole grains over refined stuff, sure, but they don't ask the crucial question. What happens if you eat no grains?
Ah, okay. So what's the specific problem with grains, according to the source? It's not just about carbs in general.
It zeroes in on something specific. The argument is the main driver isn't just sodium or just water retention on its own. It's the sodium and water retention caused by insulin resistance. And that insulin resistance is triggered powerfully by amylopectin A.
Amylopectin A?
Yeah, it's a type of carbohydrate that's unique to wheat and grains. And modern diets mean we eat massive amounts of it. That's what drives the profound insulin resistance, which then causes the body to hang on to sodium and water, pushing up blood pressure.
That's a really different way of looking at the cause. Okay, so diet is the first big step. What's the second strategy?
The second strategy is about tackling common nutrient deficiencies. And the source points out these aren't just because our diets are poor, but also due to quirks of modern lifestyles.
Or quirks, like what? And which
Yeah.
nutrients?
Let's start with magnesium, a big one. A lot of our drinking water is filtered, which removes magnesium. Plus, modern farming has depleted soils, so our produce might have 80–90% less magnesium than wild plants used to.
Wow, that much less.
Yeah, and this deficiency has a huge impact on blood pressure. For supplementation, the source recommends forms that are well absorbed, like magnesium malate, cheolate, glycinate, or bisglycinate. Avoid magnesium oxide, it's poorly absorbed.
And how much are we talking?
The target suggested is around 450 to 500 milligrams of elemental magnesium per day. And that elemental part is key. You have to check the label carefully. Of course, this assumes you have normal kidney function, and it's always best to check with a doctor.
Right, always consult your healthcare provider. Okay, magnesium. What else? Vitamin D. I feel like we hear a lot about deficiency there.
You're right, it's extremely common. Most of us live indoors, we wear clothes, and as we age, our skin gets less efficient at making vitamin D from sunlight. You really can't get enough from diet alone.
So supplementation is needed.
Often, yes. The source suggests oil-based gel caps are best, as powders or tablets aren't absorbed as well. The goal isn't just to avoid deficiency, but to reach an optimal blood level specifically, a 25-hydroxy vitamin D level of 60 to 70 ng/ml.
And how much D3 does that usually take?
Typically around 6,000 IU daily in an oil-based form, but that needs adjusting based on things like your body size, body fat, age, even race. Getting that level up helps reduce both insulin resistance and inflammation.
Okay, magnesium, vitamin D, what's next?
Iodine. This one's interesting. We don't hear about it as much for blood pressure, but it's crucial for thyroid function, which plays a role.
Iodine. Wasn't that added to salt to prevent goiters?
Exactly. Back in 1924, iodized salt campaigns basically wiped out goiters, which were caused by iodine deficiency. But then later advice told everyone to cut back on salt.
And the iodine intake dropped again.
Precisely. And we saw a resurgence of goiters and a big increase in thyroid disease. The source suggests getting iodine preferably from kelp tablets or dried seaweed, maybe better than relying solely on iodized salt, which has some issues.
Okay, and the dose?
Aim for around 300 to 400 micrograms a day. That's higher than the basic RDA, which is really just enough to prevent goiters, not necessarily optimize thyroid health. But, and this is a really important warning from the source, avoid the mega doses you sometimes see recommended online, like 20,000 or 30,000 micrograms. It's called a very dangerous practice that can actually cause severe hyperthyroidism.
Okay, noted. Huge doses are out. So prevention versus optimization, and don't overdo it.
Got it.
Got it. Is there one more nutrient?
Yes, the fourth one is omega-3 fatty acids, EPA and DHA specifically.
From fish oil.
Yeah. Fish and shellfish are good sources, but there are concerns about industrial contaminants like mercury and cadmium, which limits how much fish you can safely eat. So high-potency supplements are often recommended.
And the dose for omega-3s.
At least 3,000 milligrams of combined EPA and DHA per day is the suggestion. If someone already has coronary disease, the source suggests even higher doses, like 3,600 milligrams or more, particularly of EPA.
So magnesium, D, iodine, omega-3s, the source emphasizes these aren't just random picks, right?
Not at all. They're chosen specifically because they address these really common modern deficiencies, and they work together synergistically to help tackle insulin resistance and inflammation. And they become even more effective when you combine them with those dietary changes we talked about earlier.
Okay, that makes sense. So we've covered diet restoration and addressing nutrient deficiencies. What's the third pillar in this natural approach?
The third pillar is about fixing disruptions in our gut microbiome, specifically dealing with something the source calls SIBO endotoxemia.
SIBO, that's small intestinal bacterial overgrowth.
Exactly. The issue, according to the source, is that most of us have had way too much exposure to antibiotics over our lives. Wildly overexposed is the term used.
Yeah, that's probably true for many.
And this damages our gut flora. It kills off beneficial bacteria and allows unhealthy microbes, ones that normally live in the colon, to creep up and overgrow in the small intestine. That's SIBO.
And why is that bad? What does the endotoxemia part mean?
Well, the small intestine isn't designed to host large numbers of these types of microbes. When these misplaced bacteria die, they shed parts of their cell walls called endotoxin. It's toxic stuff.
Okay.
And because SIBO often goes hand in hand with increased intestinal permeability or leaky gut, this endotoxin gets absorbed into the bloodstream. From there, it can harm the liver and contribute significantly to a whole host of problems.
I'd have high blood pressure.
Yes, but also coronary artery disease, dementia, some cancers, even things like fibromyalgia and restless leg syndrome. According to the source, it's linked to systemic inflammation.
Wow, that's a broad range of issues potentially linked back to the gut. So how does the source suggest tackling this SIBO endotoxemia? It sounds complicated.
The solution proposed is actually quite unique. It involves making a special kind of yogurt, but not using typical commercial yogurt starters.
Oh, what kind of microbes then?
It uses specific human-sourced microbes that are fermented using a prolonged fermentation method. These aren't the transient bacteria in regular yogurt, which the source says offer only minor benefits.
Human-sourced microbes, fermented for a long time. How does that help SIBO?
These particular microbes are chosen because they can actually colonize the upper GI tract, the small intestine. And crucially, they produce compounds called bacteriocins.
Bacteriocins?
Yeah, they're like natural antibiotics produced by the microbes themselves. And they specifically target and suppress those unhealthy SIBO species.
Interesting. And what's this prolonged fermentation involve?
It's specific. 36 hours of fermentation at roughly human body temperature, around 98 to 102 degrees Fahrenheit. This long, warm fermentation allows the microbes to multiply to very high microbial counts, much higher than standard yogurt.
Okay. And how do you use this SIBO yogurt?
The recommendation is pretty simple. Eat half a cup per day. You do this consistently for at least 4 weeks to really knock back the SIBO, and then you can continue intermittently, maybe 3 times a week or so for maintenance.
And where do you get these specific microbes or the exact recipe?
For those specifics, sourcing the right starter cultures, detailed instructions, the source points people towards Dr. Davis's other materials, like his books, blog, or membership site.
Got it. And it sounds like the benefits might go beyond just tackling SIBO and blood pressure.
Absolutely. The source makes a point of saying that even if you don't specifically have SIBO, these particular microbes offer spectacular benefits for overall health. Things like better skin, improved digestion, stronger immune function, benefits for muscles, hormones, even reproductive health. It's presented as a really comprehensive gut health strategy.
Okay, so let's just quickly recap the main points from this deep dive. We've looked at 3 core pillars for potentially normalizing blood pressure naturally: moving away from just relying on meds.
Right. First, dietary restoration, getting back to a more ancestral way of eating, crucially cutting out grains and minimizing sugar to combat insulin resistance.
Second, addressing those really common nutrient deficiencies, magnesium, vitamin D, iodine, and omega-3s that are rampant due to modern lifestyles and farming.
And third, healing the gut microbiome, specifically tackling SIBO and the resulting endotoxemia, perhaps using that specialized fermented yogurt approach with human-sourced microbes.
And for listeners wanting more detail on the specifics, like the exact dosing, how to make the yogurt, where to get the cultures.
The source material from Dr. William Davis, his books, his blog, williamdavismd.com, and his membership site, jurdavisinfinitehealth.com, apparently has all that in-depth information.
It certainly presents a compelling alternative framework. It makes you think differently about just accepting medication as the only answer.
It really does.
So here's a final thought for you, the listener, to maybe mull over. Knowing that some conventional approaches might be, as the source puts it, deeply flawed, what's one assumption you hold about your own health that you're now curious to challenge? And following on from that, what's maybe one small, natural step you might consider exploring to unlock a potentially healthier path?
Good question to ponder.
Definitely something to think about until our next deep dive.